Good morning. Welcome to The Whole Truth. I'm your host, Ernestine Truth Teller, and we're here today to talk about healthcare. Our guests are Dr. Betsabel Smart, a mathematics professor at MIT, Phineas Meafirst, CEO of Total Health Investments, and John Clarity, a healthcare advocate from Heal, California. Good morning, everyone. 5 years ago, the U.S. implemented Obamacare, the most significant healthcare reform since Medicare. Today, let's look at its impact.
Excuse me, Ernestine, but let me clarify. The reform wasn't really about health care. It was more about health insurance. There's a difference.
Interesting, John. Could you explain?
Of course. Before Obamacare, the insurance companies could refuse to insure sick people and even cancel people's insurance when they got sick. After Obamacare, that's illegal. But now, they have new ways to deny care.
Wow, that sounds downright ruthless. Mr. Meafirst, could you comment?
Yes, it's very simple, really. We have to take in more money than we spend. This is a business, you know. We have shareholders to report to, and sick people cost our company a lot of money.
Well, it sounds like you were making money by denying sick people health care.
Sure, and we still are. It works great. We're making money hand over fist.
Never mind about the shareholders, Phineas. How about your paycheck? Before Obamacare, you were earning over $20 million a year. And now it's even more, right?
It's not nice to talk about what people earn, John. And $20 million doesn't go as far as it used to.
Wait, gentlemen. First, denying sick people care might be a great moneymaker, Finney, but wouldn't you say it's cruel?
Cruel? Hardly. Everybody in this country gets the best health care they can afford. It's the American way.
Well, thousands die every year because of health insurance corporate practices, like charging high upfront costs and outright denials of care.
Of course they die. People die every day. That's not my problem.
That may be true, but now that the law has changed, now that flat-out refusing to insure sick people is no longer an option, how do healthcare insurance companies make money? I mean, their stock has skyrocketed since Obamacare became law.
Oh, we have our ways, like reduced utilization. You know, we discourage people from even going to the doctor with complicated doctor networks. And if they do see a doctor, they owe thousands in deductibles before the insurance even kicks in. And after that, there's the co-insurance, what we call the patient's share of the costs. With some insurance policies, the patient has to pay 40%. So we pay as little as possible, really. Patients are on the hook for thousands in deductibles and co-insurance. You should see the letters we get when the poor suckers realize their costs don't end with high premiums. What do they expect? We're a corporation. We make money.
I see. Well, that's very unfortunate indeed. Which brings me to our next guest, Dr. Betsabel Smart of MIT. Good morning, Betsy.
Good morning, Ernie. Thank you for having me on the show today.
Betsy, I understand you have a PhD in mathematics. Could you please walk us through how a patient would calculate their share of their healthcare costs if, say, they had an appendectomy?
Of course. Anyone with a background in calculus can figure it out.
Bet they can't.
The truth is, even if everybody knew calculus, it would be impossible to figure out their medical bills.
Well, it is a challenge. To begin with, healthcare prices are crazy. The cost of a plain old appendectomy in California can cost between $1,500 and $186,000.
What? That's ridiculous.
Still, no matter how irrational your health costs are, I've developed a formula that can be used to figure out how much you'll have to pay. It's called the minimal payment equation, or MPE. Z is the amount of your medical bill, X is your coinsurance, Y is your deductible, and 0 is the amount your health insurance will pay.
Wow, Betsy. So no matter how much you might pay in deductibles or coinsurance, the insurance company can get off paying nothing. Amazing. Viewers, this formula is available at thewholetruth.com.
Wait a minute. You're kidding, right? This is nuts.
Outstanding, Dr. Smart.
Well, folks, that's all we have time for today. Tune in tomorrow for more of The Whole Truth, when we'll be talking about student loan debt.